time, but the reason I'm telling you that is do stay tuned. I've got some fantastic videos. Almost every day I'm getting some really interesting cases. Spike can be exacerbated after performing microsuction, so they prefer having it removed manually. It can be a lot more difficult to remove earwax manually, particularly in this case because of the consistency of the earwax and also the ear geometry and anatomy. They've got a very narrow, almost shut entrance to the ear canal, and then once you get in there it's quite bendy and twisty. Now, the reason why I'm excited about this particular case is if you watch this patient's previous case, it's video number 1297, and I'm going to add the link in the description. Using the Rai Curette was far easier than the last time I treated this patient using the traditional Jobson horn. And in that case, not only did I use a traditional Jobson horn, I also used a metal version. Now, what's typically quite difficult in this case is reaching out for the more deeper, softer wax. And that's where the bent version of the Rai Curette comes into its own. Most earwax removal manual instruments, in the UK at least, they're straight handle. Now, if you wait till the end of the video, you're going to see a still image of this Rai Curette, so it gives you an idea of what I'm referring to. Having the bend in there not only gives me more reach inside the ear, but it also provides more maneuverability. But additionally, it prevents your hands crossing over, and it also prevents the earwax view being obstructed. Now, if you've got deep earwax, and I'm right-handed, so I'm holding the instrument, the Curette, in my right hand. If you've got earwax deep in the ear and it's on the right-hand side in particular, what can happen with a straight instrument, as you're entering the ear with the instrument and leaning over towards the right, the hand that you're holding the instrument in can actually cross over and obstruct your line of view, which is obviously not ideal because you can't really see what you're doing inside the ear. So with the bent version, your hand never ever needs to, or in fact does, obstruct your line of view because it's always out of the way, and that's a major benefit. And if you compare this procedure to the procedure I performed 6 months ago, where I used a straight handle Jobson horn, and in fact in that case I also used a metal Jobson horn, a Curette, because the metal one's actually longer than the plastic ones that we normally use, and I needed the metal one last time for that extra reach, but it was extremely difficult to remove some of the wax that was on the canal wall last time, especially on the back part of the ear canal. But with the new Rai Curette, the bent version, it worked to treat. Now, it may just be a one-off in this particular case. When this patient comes back in 6 months, I may experience some of the difficulties I did in video 1297, but only time will tell. The patient themselves even commented saying this time it's far quicker, and not that it was uncomfortable last time, but because of the metal instrument, if you do make even a slight bit of contact with the canal wall, patients can feel it a bit more, and in this case they didn't feel anything. So the patient themselves noticed a difference in the treatment they were receiving. So it was all very positive, and I'm really thrilled by how well this procedure went and how well the Rai Curette performed. So you are going to get some natural surface wax, but we're not going to try and scrape and remove that, because by scraping the ear I'm going to cause more trauma. Bit of wax is good for you. I did also mention that in video 1297, and I also mentioned, because I watched that video back, I also mentioned that sometimes I receive emails if I leave a bit of wax from people, disgruntled viewers who are not happy and feel that I don't know what I'm doing. So guys, please be kind. Bit of wax is good for you. I'm trying to remove all the excess, larger pieces of wax, but we all produce wax for a reason. It's there to protect our ears, to moisturise the skin. Without the wax, the skin that lines the ear canal becomes very dry because moisture within the skin cells rises to the surface, and without this protective hydrophobic wax and oily sweats and lipids, the moisture within the skin cells then gets evaporated. So having this wax sitting on the skin is a natural moisturizer. Also, earwax is mildly acidic, and what the acidity does, it helps to prevent harmful potential bacteria in the ear from becoming harmful, pathogenic. So our ears are full of bacteria and fungi. In mild acidity, the bacteria generally is non-pathogenic, but if the pH level increases and becomes more alkaline, then some of these bacteria can become pathogenic, and it also then allows the perfect breeding ground for other bacteria to enter the ear and become pathogenic. So earwax helps to inhibit harmful bacterial and fungal growth. Also bacterial fungi, so whereas pathogenic bacteria are what we call neutrophiles, optimal pH is more neutral. Fungi is more, it becomes pathogenic depending upon the humidity in the ear and the warm temperature of the ear. Also, earwax is sticky, as you can see. So it traps any foreign particles, dust, dirt, pollen. And in the main state, earwax naturally migrates out of the ear. So of course in this patient it's not, they have to have it removed every 6 months. In part, I think that's due to their narrow entrance of the ear canal. Also the consistency of the wax is very sticky. You may have also seen there the curvature of the curette. I've put a little curve in there to mimic the curvature of the ear canal, which then makes removing soft sticky wax off the canal wall far more comfortable for the patient. All other curettes and Jobson horns that I've used are straight. There's no curvature at the tip. So when you're then gliding it against the canal wall, which is slightly rounded and curved, it creates more friction and it can become a bit more uncomfortable for the patient. So this is their left ear. This left ear is always has less wax. There was a bit there, say partial occluding, so I'm just mopping it up for the patient. They don't have any symptoms per se, but just whilst they heal the right side, I might as well just remove some of the bigger lumps. And you can just see how well the Rai curette is moving and gliding across the surface of the canal wall to remove wax. So guys, I've got so many great videos. I'm slightly concerned because I don't know how I'm going to get the time to upload them all, and but the iClear phone, iClear scope, I'm using the iPhone SE, and my memory's full, so I'm gonna have to probably just spend one day, maybe at the weekend, just uploading multiple videos, I think, just to get these off my phone. But I don't know if I've got the time, but the reason I'm telling you that is do stay tuned. I've got some fantastic videos almost every day. I'm getting some really, really interesting cases.